Hi, my name is Caitlin Fleming. I'm a speech language pathologist, and your doctor has asked me to take a look at how things are working in your mouth and throat. I've had a chance to review your medical record already. I'd like to ask you some questions about eating and drinking.
Okay.
Have you ever had your swallowing evaluated before?
No.
This helps me understand if you've had swallowing concerns in the past and whether any testing or recommendations have already been made.
Okay.
Have you ever noticed any changes with eating, drinking, or taking pills?
No.
This gives me just a general idea of any swallowing problems you may be experiencing. Does eating or drinking ever make you cough?
No.
I ask this because coughing can sometimes be a sign that food or drink is going toward the airway instead of to the stomach. Is there ever anything left over in your mouth after you chew and swallow?
No.
This helps me learn if food is clearing from your mouth the way that it should be. Do you ever feel like something is stuck in your throat after swallowing or taking pills?
No.
This helps me understand if food or pills may not be moving through your throat as easily as they should. Are there foods or drinks you avoid because they're difficult to swallow?
No.
This helps me identify which foods or liquids may be causing difficulty. Do you have any heartburn or a sour taste after eating?
Mm-mm.
I ask because stomach acid can sometimes affect swallowing and throat comfort. Have you had any changes in your weight in the last 6 months?
No.
Weight changes can tell me if swallowing problems are making it harder to eat enough. Has your appetite changed in the last 6 months?
Mm-mm.
This helps me understand how eating and swallowing may be affecting your interest in food. Are you having any pain when you eat or drink?
No.
Pain while swallowing can give us clues about what might be causing the problem. Are you having any difficulty swallowing your saliva?
Mm-mm.
This helps me understand how well you're managing swallowing throughout the day and not just during meals. Tell me about what a typical meal looks like for you.
What I eat for my meal or just me eating my meal?
What do you eat for your meal?
I'll eat tuna, salmon, lima beans, eggs, pizza rolls.
A good variety.
Mm-hmm.
Okay. This helps me learn about the food you eat and whether you've made any changes because of swallowing difficulties.
Okay.
Do you have any personal, cultural, or religious considerations related to food and drink?
Mm-mm.
I want to make sure any recommendations I make fit your preferences, beliefs, and lifestyle.
Thank you.
Thank you for answering those questions. Your answers help me better understand your swallowing and decide whether any additional testing or treatment might be helpful.
Thank you.
When we're providing an oral mechanism exam for an adult for a overall clinical swallow evaluation, we're looking for multiple things, and those have to do with the articulators. So we're looking for motor function, strength, coordination, and symmetry. So to begin, we will be looking at the face and the lips. So what we need to be looking for when we are assessing these two articulators is weakness or a lack of coordination, because this could cause anterior spillage out of the mouth when we go to swallow. So the first thing I'm going to do is have the patient open their mouth just really wide. So go ahead and open your mouth. Great. So now we're just looking for symmetry. We're looking at the inside of the mouth, looking at the hard palate, the soft palate, the tongue, as well as the dentition. Then I will go ahead and ask the client to do some movements with their mouth. But while we're looking in the mouth, like I said, we want to look at the dentition, because if we have poor oral care, we are actually increasing our risk for aspiration pneumonia. So now I will ask the client to pucker their lips, so like such. Then I'm going to ask them to retract it back. So they're going to spread their lips and say E. E. So now I'll go back and forth. E. E. Great. Okay, so we're, like I said, looking for symmetry, looking for any sort of abnormalities, and we're having them do that back and forth motion. And after I've done that, I'm looking for the strength of the kind of the cheek muscles, so the muscles of mastication. So I'm going to have the client blow up their cheeks with air, and I'm looking also for that labial, so the lips to seal together and then be able to hold that air within their mouth. So then I'll ask them to puff up their cheeks, but hold the air in. So great. Looking for that labial closure up front, still looking at symmetry. That looks great. They can blow the air out. And then we're going to move on. And now we're going to look at the tongue. Now, the tongue is important for mastication, but also for bolus formation. So we want to look at the strength, the range of motion of the tongue. And what I'll ask them to do is to protrude the tongue. So stick out your tongue. Then I'm going to ask you to move it side to side, so left to right. So I'm looking for that lingual movement. Great. At this point, we also want to make sure they're just isolating the tongue movement and not also kind of overcompensating with the jaw at this time. So like I said, bolus formation and transit, our tongue is going to be very important. So we can also ask them to move the tongue kind of around the oral cavity. So up, around, and down, all the way around the mouth. Great. And then I'll see if they can lift the tongue up to the alveolar ridge. So what I'll do is I'll ask the client, please, can you put your tongue to the top of your teeth or behind the teeth? So once again, looking for that tongue movement. Can it go up? Can it go back down? Looks great. And at this point, like I said, tongue elevation, tongue depression. Once we have finished up there, we can get a tongue depressor. So this is also looking at muscle strength. So I can ask the client, can you please go ahead and stick your tongue out? I'm going to gently press on the tongue, and I want you to push against this. Don't let me push down on your tongue. Great. So I'm looking at that tongue strength. Looks nice. Now we're going to do the same thing, but I'm looking at the kind of how the tongue can push from side to side. So go ahead and stick your tongue out again. I'm going to put the depressor on one side. I want you to push against it. Great. I'll go to the other side, push against it. Great. I can feel that lingual strength. Once we've finished up with the tongue, range of motion, and strength, we'll move on to the jaw. So this is important for coordination of mastication, and it also serves as an attachment for our tongue. So when we're looking for abnormalities, we can see, are they overcompensating with their jaw, or is something going on between the two? So is it okay if I put my hand under your chin? Okay. So what I'm going to do here is I'm going to put my hands under her jaw, and I'm going to see if she can kind of open the jaw and push against my hands. Great. Great. I can feel the mandible moving against my hands, making sure there's some muscle strength within there. So that looks great. And let's see. So I'm going to take my tongue depressor here. I have a new tongue depressor. And what I'm going to do is, yet again, see the positioning of the jaw and the strength. So I'm going to put these at the bottom of your teeth. I want you to open up. Okay, and this time I want you to try and pull up against the tongue depressor. Great. Perfect. Just like that. That is pretty much it for the mandible, for the movements of the jaw. I didn't see anything abnormal. Symmetry was great. Strength was great. Now we move on to the teeth. Like I said, the dentition. I was able to look at this a little bit at the beginning of the oral mech exam, but if I feel like I need a better look, I can have her open back up. I'm going to take a phone flashlight here, and I'm going to ask you to open up. And like I said, looking for any abnormalities of the hard palate, the soft palate, looks great. The uvula back there, I'm looking for the tongue and the dentition, or all the teeth there. Are there any abnormalities that kind of stick out to me? And on this patient, everything looks great. So we can move on. So another thing we want to look at during this oral mech exam is for a volitional cough. So what we do is just ask the patient to cough as if they were trying to kind of get something out of their throat. So why we're looking for this is in the case that a patient was to swallow and aspirate, or if a bolus was to penetrate, we want to make sure that the cough reflex is present. So I would just ask my patient to go ahead and do a strong, clear cough. Thank you. Like I said, during that exam with the flashlight, I was looking inside her mouth for the hard and soft palate. There are times when a patient may have a submucous palate, so a cleft that is not really noticeable to the naked eye, but if we look closely, there might be some discoloration there. So that is a good thing to look out for. Now we're going to move on to more of phonation respiration tasks. And this is important, of course, to kind of see the strength of those muscles of respiration, but also the muscles that we use for swallowing. So, what I'm going to have you do first is open your mouth back up. And I'm looking in the back of the throat again, and I'm going to have you say, ah, ah. Good. Now I want you to say, ah, 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 ah. Ah, 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 ah. Great. So I'm looking for that upward motion of that hard and soft palate. Everything looked great. Didn't notice any abnormalities in those pillars in the back. So to wrap up, like I said, we're going to do a little bit more of sustained phonation. So what I'm going to have to do is ask the client is to take a deep breath. And what you're going to do is say ah for as long as you can. So typically we'd say for a child, they should be able to sustain the ah for about 10 seconds. So kind of same thing here with the adult. We would just want to make sure there's no shaking in the voice or stopping of that phonation kind of on and off. Whenever you're ready. Ah. Yeah, that was great. Thank you. Okay, so that's our sustained phonation task. You can do that trial a couple of times just to see how that sustained phonation is going for the patient. Nothing has been of concern here. I think the breath sounded strong and the phonation seemed great. So our last task is our DDK task, and you can use different terminology for this. Taco Bell, Buttercup, or typically for adults, we'll use our Putica. And the reason we do this is we're listening for potential dysarthria, any weakened, paralyzed speech, because when we notice these things, they might also be at an increased risk for dysphagia or aspiration. When you look kind of into research as well, there are findings with correlation between the DDK task and reduced laryngeal and hyoid elevation. So just things to kind of look out for there. So what you're going to do is ask the patient to repeat the Putica as quick as they can. So it could look something like this. So we're going to do a little bit of a speech task. Go ahead and say pa, ta, ta, ka, ka. Now say it all together, Putica, Putica. Great. So we're going to do that, and I want you to try and do that 5 times in a row. Putica, 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 Putica. Great. So I didn't notice any sort of weakened or paralyzed speech there. So I would go ahead and say that her phonation and her articulation is looking really great. So that pretty much wraps up our oral mech exam. So during this task, take note of any kind of differences or outliers in any of these areas. Like I said, we're just looking again at all of the articulators, symmetry, motor function, strength, and coordination.
All right, so today we're going to test your swallow and your cranial nerves. All right, so first I'm going to lightly touch different areas on your face, and you're going to let me know where I am touching.
Okay. Forehead, cheek, nose, chin, cheek.
Good job. All right, and then I'm going to feel under your jaw while you clench your teeth. All right, and now I want you to open your jaw with the resistance from my hand. Good job. All right, now we're gonna do a taste test we're gonna taste, we're gonna taste test, and you're gonna use a spoon to get small amounts of water, and there's gonna be 3 different kinds, and I want you to try to see if you can identify which kind it is.
That's sweet.
Okay, yeah, that's correct.
Salty.
Uh-huh.
That's sour.
Good job. Those are all correct. All right, and now I want you to raise your eyebrows and then close your eyes while your eyebrows are raised. Good job. All right, now I want you to puff out your cheeks. Good job. And then I want you to smile and reveal all your teeth. Good job. All right. And then we cannot determine cranial nerve 10 sensory function because we don't have the right instrumentation for that. So we're just going to move right ahead. I would like you to say ah for as long as you can.
Ah.
Good job. And then I want you to say ah, ah, ah in a sequenced motion.
Ah, 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 ah.
Good job. And then I want you to count from 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Good job. All right. Would you be able to produce a fake cough for me? Can you do another one? Thank you. All right. And then I want you to extend your tongue straight out. Good job. All right. And then you're going to move your tongue side to side with resistance. All right. Push against it. And then push against it. Ooh. All right. Good job. All right. And then I want you to bring your tongue up and down. Good job. All right, so cranial nerve 5 is important for your chewing, preparing the food inside your mouth, and your jaw movement during swallowing. Your facial nerve, cranial nerve 7, is important for swallowing because it contributes to lip closure, bolus control, and your saliva. And then cranial nerve 9 is important for sensory and motor roles during when the food is being prepared to go back. And then cranial nerve 10 is important for swallowing because it controls your muscles for the pharynx, larynx, and esophagus. And then cranial nerve 12 is the primary motor nerve of the tongue and plays a crucial role in the oral preparatory and oral transit phase of swallowing. So your cranial nerves and your swallowing is all normal and good.
Awesome.
Hi, my name is Charlotte, and I'm going to finish up your clinical swallow evaluation today by presenting you some food and some drinks. So I'm going to tell you what I give you before each bite, and when you're done swallowing each item, I'm going to ask you, how does it feel? Is everything good or okay? And I do want to hear you say that because I am listening to what your voice sounds like after you take a swallow. And I'm going to put some gloves on for your safety. And before I give you a bite or a drink of anything, I'm always going to tell you what it is so that you know what's coming. If at any time you don't feel safe, I just want you to let me know and we can stop. So the first thing that I'm going to have you do is just swallow whatever's in your mouth dry. That'll give me a baseline of what your swallow looks like. Okay, and can you open your mouth? And how did that feel?
Normal.
Okay, so the next thing I'm gonna do is have you take a teaspoon of water. So you can take your teaspoon. I know you can feed yourself, so you're gonna grab your cup, put the teaspoon of water. Now, when you put it in your mouth, I want you to hold it in your mouth before swallowing it, and I will tell you when to swallow. Okay, and swallow. Okay, and open your mouth. And how did that feel?
Fine.
Okay. All right, next I'm gonna have you take just a regular sip like you would every day from the cup.
Hold it in my mouth.
And you're gonna hold it in your mouth, like it's right. Okay, and you can swallow. Okay, and I'm gonna look in your mouth. And how did that feel?
Fine.
Good. Okay. All right, now I'm gonna have you take another sip from the cup, but this one I want you to take it a little bit bigger than you normally would.
Okay.
I'm still holding it in your mouth. Okay, and swallow. Okay. Open your mouth. Getting some pathology, all right. And how did that feel?
That was fine. Didn't realize you need to swallow 3 times to take a gulp like that.
Well, good. That's what we're doing this for. That's what we're looking for. All right, and now I'm gonna have you take 2 sips in a row from the cup. So in this one, you don't have to hold it in your mouth. You're just gonna take a sip and swallow, take a sip and swallow.
Okay.
Great. Okay. And open your mouth. And how did that feel?
Fine.
Okay. All right, so now I'm gonna have you do the same thing we just did, but this time with a straw. So you're gonna take 2 sips in a row from the straw. So like you normally would if you were drinking soda, you're not gonna take the straw out and take a break in between. You're just gonna do sip, sip,
Okay.
and swallow. Perfect. Okay. And how did that feel?
Fine.
Okay. Now we're gonna start with our food. So we're gonna put our water away for a minute. I'm gonna move that out of the way. And the first thing I'm gonna have you do is take your spoon and take 1 bite of applesauce. And so just like we did with the water, I am gonna have you hold that in your mouth and I'll tell you when to swallow, okay? All right, and swallow. Okay. And how did that feel?
Good.
Okay. All right. All right, and next I'm gonna have you take 1 bite of your fruit cocktail. And so you're gonna take some of the juice and a piece of fruit, and you're just gonna chew it and swallow like normal. You don't have to hold it in your mouth. Okay, and how did that feel?
Good.
Okay. All right, and then you're gonna take 1 bite of your cookie. You good?
Yeah, I am.
Okay. All right. There we go. All right. And how did that feel?
Fine.
Okay. All right. And then the last thing you're gonna do is I'm just gonna have you take 1 more sip with the straw, without the straw, it doesn't matter. Just wash out your mouth. All right. And 1 last check. And how does everything feel?
Fine.
Excellent. Okay. We're all done.
Great. Thanks.